The main takeaway from our study is that the Visceral Adiposity Index, a simple non-invasive surrogate for visceral fat, is independently associated with cardiometabolic multimorbidity in older adults and can modestly improve risk prediction beyond traditional risk factors. Hello, my name is Setor Kunutsor, and I am a professor and a researcher in cardiology at the section of cardiology, Department of Internal Medicine, University of Manitoba, Canada. I'm here to discuss our paper titled Visceral Adiposity Index is associated with cardiometabolic multimorbidity and improves risk prediction, the English longitudinal study of aging. It will appear in the February 2026 issue of Mayo Clinic Proceedings. But first, I'd like to acknowledge and congratulate my co-authors for their excellent efforts on this manuscript. Using a large population-based cohort of over 3,000 adults aged 50 years and older, based in the United Kingdom, we investigated whether the Visceral Adiposity Index, calculated from waist circumference, body mass index, triglicerides, and HDL cholesterol, is associated with and predicts the development of cardiometabolic multimorbidity. We define cardiometabolic multimorbidity as the co-occurrence of two or more of diabetes, coronary heart disease, and stroke. We found that higher visceral adiposity index was strongly and independently associated with incident cardiometabolic multimorbidity, even after adjusting for age, sex, socioeconomic status, lifestyle factors, and comorbidities. The association was consistent with a graded dose response pattern. Importantly, adding visceral adiposity index to a traditional risk factor model modestly improved predictive accuracy for cardiometabolic multimorbidity, as reflected by statistically significant gains in measures of discrimination, such as the C-index. This finding suggests that visceral adiposity index may serve as a practical and cost-effective clinical tool for identifying individuals at high risk of developing multiple cardiometabolic conditions. Unlike advanced imaging techniques, visceral adiposity index uses easy-to-obtain parameters and could be potentially integrated into routine clinical risk assessments, especially in resource-limited settings where access to imaging or advanced diagnostics is constrained. For patients, this means early identification of those at high risk of developing multiple chronic cardiometabolic conditions, allowing for timely preventive interventions. Patients can also better understand the importance of visceral adiposity, not just overall weight, but as a health risk. Monitoring visceral adiposity index may empower individuals and providers to target lifestyle changes more effectively. While the current findings are promising, further validation in diverse populations and age groups is necessary, including those outside of Europe and younger cohorts. Future research should also explore how dynamic changes in visceral adiposity index over time relate to risk trajectories, and whether targeting visceral fat reduction can reduce the risk of developing cardiometabolic multimorbidity in clinical trials. To learn more about our methods, results, and implications, I invite you to read a full article in the February 2026 issue of Mayo Clinic Proceedings. Thank you for watching.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.